See, I let the Zoom American woman tell you that it's been recorded. And as you came in, it will have told you that you've given us permission to unmute you. We did that because we want to ask everybody when you're not speaking to stay muted, but we can unmute you if you struggle to get unmuted again, if that makes sense. And we will mute you if your background noise is stopping other people being able to hear or anything. You know, as lovely as it is that we'd like to meet your dog, we don't really want to hear them over Chris and Jenny and Henry who are speaking.
Yeah, but it's always good to see cats and dogs on screen.
Yeah. So welcome everybody. I'll hand you over to Jenny, who's going to be introducing us all today.
Hi everyone, I'm Jenny, and this is I'm co-chairing with Sam, and welcome to the COVID research webinar. We'll introduce Chris Hatton.
Thanks, Jenny. I think that's about as much introduction as I should get. Thank you. So with Jenny and Sam and Sue and many other people all around the UK, we've been doing a research project trying to track the experiences of people with learning disabilities through COVID. And in this very short presentation, I'm just going to do the sharing my screen thing and hope that it works. So hopefully you can see the screen. Now in the project's got lots of stuff. And sorry, Jenny, there is one boring slide of X hundred people, which I'll go to first. There we go. So this is a project across the UK. We spoke to people 3 times over the course of just under a year in the pandemic. The last time was last summer. We're hopeful that we will be able to go back to people later on this year as well. And we spoke to many hundreds of people with learning disabilities, and we also did surveys with family carers or support workers of people who couldn't take part in an interview themselves. And today what I'm going to do is go through kind of the main things about England. So obviously we had information from across the UK, but we had lots of people from England as well. And working with Learning Disability England, we worked through, of the mountain of stuff, the mountain of information that we collected, what are the really most important priorities? What are the most important things that kind of jumped out at people across Learning Disability England and PMLD Link as well, and what things need to change. So basically we've got 7 things that came out as really important at the end of the project. And I imagine that none of these will come as a surprise to any of you on this call. So the first thing was about jobs and money. Fewer people with learning disabilities had paid jobs the 3rd time we spoke to people last summer than they did before the pandemic. Some people had been furloughed, some people had had their jobs held open, but not as many people were in paid jobs last summer than they were before the pandemic. In group 2, which is the group of people who we got surveys for, so they're people with kind of greater support needs, very few people had a job before the pandemic, but that also went down as well. So kind of people's kind of paid jobs hadn't returned to what they were like before the pandemic. And the same thing was true for volunteering as well. So while about half of people were doing volunteering jobs before the pandemic, that went down to about 3 out of 10 people by last summer. So volunteering opportunities aren't coming back either. So in terms of ideas for change, and again, these are things that were around before the pandemic, but I think the pandemic has made worse. There should be more jobs, more proper paid jobs for people with learning disabilities. There also should be more volunteering jobs available. People with learning disabilities have a lot to contribute and want to contribute, and we need to not get in the way of that. And it should be easier for people to work, particularly paid work, just some of the time, and not have to worry about what impact that's going to have on the benefits. they get. So this is a real block to people, thinking I can do kind of quite a part-time job, or I can do the kind of job where there's more work some weeks than others. The benefit system really kind of squashes that, I think, and kind of fear of being sanctioned. So that's the first thing, was jobs and money. The second thing was about mental health and well-being. So group one were the people with learning disabilities who we interviewed. So we interviewed kind of using Zoom or phone or Teams or FaceTime, whatever. And around half of people at each time we spoke to people. First time we spoke to people was in the lockdown in the middle of the winter before last, when it was sort of Christmas panic and, full on lockdown for a few months, through to the summer when restrictions were pretty much lifted. Around half of people in group one saying they were lonely every time we did the interviews. So that hadn't improved over time. There were some people who said they felt worried or anxious kind of pretty much all the time during the pandemic. And a lot of that was worries about not only getting COVID themselves, but trying to keep other people safe too. And some people have said that they felt sad or down, again, pretty much often or always. So people would, have much more sort of isolated lives in many ways than people had before. And in the surveys, with people who couldn't respond to an interview themselves, we asked the people who were doing the survey, so a family carer usually, how they were getting on as well. And they said sort of caring during the pandemic meant people felt really tired and stressed. And that, again, wasn't improving over time either. So in terms of ideas for change, people talked about people with learning disabilities needing more opportunities to meet other people. So particularly when sort of day centres were shut, some people were using day centres, or just generally in life, that there isn't really much of a chance to meet other people. So there needs to be many more opportunities to meet other people. People need much better advice about mental health. We know a lot of people are on mental health medications like antidepressants or even antipsychotics. But there doesn't seem to be much around that's actually around good mental health support to help people kind of work through what the issues are for them. So people need better advice around mental health, what people can do and what support people can get to help with their mental health. And families also need more support. So families, particularly people with greater support needs, were talking about feeling pretty kind of forgotten and abandoned through the pandemic, and that didn't really improve over time. The third thing we talked about was services. Basically, a lot of services, things like day services, but also things like kind of community support and community activities, help from PAs, particularly when you're sort of going out. All that sort of pretty much ground to a halt for most people in the first lockdown compared to before the pandemic. And although some of that was coming back by last summer, it wasn't coming back to how it was before the pandemic. And so people were not getting the same levels of support than they were before the pandemic. Some of it had gone online, so there was some kind of online stuff, and some of that was still around, but face-to-face stuff hadn't returned to how it was. So not everyone was getting enough support before the pandemic, even, and we know that because of other work that's been done, and people should be getting more support now. Kevin, I see your hands up. I've only got a short talk. Is it all right if you wait till the end of the presentation? Is that okay? Great. And that people should be getting more support now. This was an issue from before, and the pandemic's made that even worse. But also it might be the chance for services to think about how they can change towards what people want. So one of the good things that some people said about the pandemic was that they didn't have to sort of rush off to, your kind of 9:30 appointment in a service, which people weren't really enjoying. So this could be a chance to have a conversation with people about what support they actually want, and to do some things differently compared to how they were done before the pandemic. And services shouldn't assume that online is the same as face-to-face, but they also shouldn't assume that face-to-face is a thing and nobody wants online. A lot of people like some of the online stuff that was being done. So people should be asked what they want, what the balance should be. The fourth thing out of the 7 that people raised was about health. So during the study, just over half of the people we interviewed, who were the people in group 1, rated their health as good. And that reduced over time. So by the summer, in group 2, who the group with greater support needs, early on, about half of people saying their health was good. By the summer, that had dropped to about 2 out of 10. So people saying that people's health was getting worse as people were kind of stuck inside, isolated, not doing their usual things, that people's health was getting worse. By the summer of 2021, 4 out of 10 people said they'd had an annual health check. Those people who usually had one. Sometimes that was in person, but quite often it was by phone or video call. And I think people were sometimes saying it wasn't as good a health check as they'd had before. And again, fewer people were seeing their GP, their sort of local doctor, than they used to as well. And again, a lot of that was by phone, a bit of it was online video, some of it was face-to-face, but it hadn't gone back to the levels it was before, even though for many people their health was getting worse. So in terms of ideas for change, annual health check should always be done. And again, there's kind of targets for this, and NHS England saying they're meeting their targets for how many people are getting them. But I think there's a real question about how good they are and whether they're actually going through to people getting the test they should be getting or the health treatment they should be getting. It needs to be easier to get an appointment at the doctors. I personally find this really confusing because now there's, you ring up and there's lots of, background music and it's press 1 for this and press 3 for that. And every time they're trying to basically say, don't contact us, what my GP's message is. So it needs to be much easier to get an appointment at the GPs, because that can be really hard for all sorts of people. And people might have not gone to the doctor because of the pandemic. So either because they're worried about COVID or because there's a very strong message that, health services are overwhelmed. So don't kind of come to us unless it's drastically serious. So a lot of people haven't had kind of the health services and health support that they should have been getting. So there might be some health problems that are getting more serious because they haven't been looked at. So there needs to be more support now for people with learning disabilities so people can see who they need to see. In terms of using the internet, most people who we spoke to had access to the internet, and that might be because of how we were contacting people. But fewer people who were part of the survey had access to the internet where they lived and access to a device that they could use the internet with. People really, it was a really kind of positive aspect, I think, of the pandemic for many people. Suddenly people, got access to stuff that they hadn't had access to before. And people learned how to use, Zoom and other things. People were mainly using the internet for keeping in contact with friends and family, and also many self-advocacy groups and Learning Disability and others were putting on kind of online activities too, and people really enjoyed those. And I think from sort of this sort of not being services saying this wasn't possible for most people, suddenly it was. And we need to keep up that momentum, really. People need more support to help them to learn digital skills. The people around them also need support so that they don't get in the way of people learning digital skills. And everyone needs access to digital devices, because it's not only having access to like a tablet or a computer, but it's also being able to, pay for the Wi-Fi, data, those kinds of things. So everyone needs access to that. Information was a 6th thing. We asked people where they got their information from about COVID, and all the way through it was television. Most people got information about coronavirus rules from television. So it wasn't from government websites or government guidance. A lot of people with learning disabilities in group 1 didn't find it easy to get good information, and family carers and family members and paid carers said that as well, that it wasn't always easy. So guidance would come out late, or it wasn't there, and it often wasn't in easy read, or it was produced quite late, and it was sometimes quite confusing. So in terms of change, TV is a really good way for people to find out information about coronavirus, but we need to make sure that TV does it in a way that it works for everybody, including people with learning disabilities. Government information needs to be accessible, and it needs to be properly accessible at the same time that everybody else gets the information. I mean, quite often the guidance will come out incredibly late or near deadlines anyway, but easy read and other accessible ways of getting the information need to come out at the same time. Organisations like Learning Disability England and many other self-advocacy groups really stepped up to the plate, and they produced accessible information really quickly when government didn't. But it should be government's job to do that, really. And families of people with the greatest support needs must not be forgotten when important information was shared. And again, we're going to see a couple of snippets from films later on that really kind of bring that out. And finally, the last thing is about the experiences of people with greater support needs. So this is particularly about people with profound and multiple learning disabilities. So this is the group of people with the greatest needs for support, and we found that they were less likely to get support than all other groups of people with learning disabilities in our project. So the people with the greatest needs were getting the least support. People are still, certainly by last summer, and this will certainly be the case now, some people with learning disabilities with greater support needs were shielding or effectively shielding. So whether it was sort of an official letter or not, people were kind of behaving in a shielding way to keep themselves and other people safe. Some people were still shielding all the way through the study, and by the summer, in the sort of the group of people with greater support needs, 2 out of 10 people were still shielding. And even now, as restrictions get lifted more and more generally, they're just left kind of about feeling very abandoned and forgotten, and not seeing a way that will get better for them. So support for families of people with PMLD, so profound and multiple learning disabilities, should be urgently improved. So these are people who have really experienced a lot of isolation, a lot of withdrawal of support services, which people need kind of daily or weekly. It should be really an urgent priority. And services need to connect with people who are shielding to find out what they need rather than leaving people to it. So that's all I've got, Jenny, so I'll stop sharing my slides. Is it over to you, Jenny, or do you want me to field any questions that have come up?
Is there any questions?
I think Kevin's been very patient with his hand up.
Are you there, Kevin?
I'm there, yeah. Do you want me to see?
Yeah,
I'm
go on.
in the cafe. Yeah, questions. I think should have kept the COVID tests, and there should have been 3 lateral flow tests. Should have been that, and also if you got COVID, it's going to spread it at work, isn't it? Because I work at Royal Mail, not Allswells, and basically it's everyone's got to take precautions still. But and my friend got COVID, and he isolated 5 days. His company helped him out. So, but I think they should have kept the isolation period 5 days still. But now they scrapped it. It's unsafe for some people who work because some people just think it's just normal flu and spreads like that. But I think the infection rate's high in Scotland. It was high in England a couple of weeks ago. But I think the countries did really well. It's Wales, the country did better than the rest of the other countries in the UK. I think they did well, good job, because they did a proper job, the Welsh government, looking after their citizens. But the thing is that people with disabilities, they want people to wear face masks still, because I think that if they don't wear face masks, it spreads the disease. And I think also the air travel, they relax too much, and that's why the virus is coming in as well. But if they did more checks, I think France did a better job as well, France and Spain. Is that right?
Yeah, I agree on all of that. And when we asked people what would help them kind of feel safer, so people could go out, they said exactly those things. They said, we need to keep things in place to get rates of infection down, because if there's high rates of infection, exactly as you've said, the risk going anywhere becomes really high for some people. And they said exactly what you said about PPE, about kind of continuing kind of lateral flow tests, all of those things which you can clearly see, help keep rates lower than they would be. People are saying all those things need to be in place, and we've gone in entirely the opposite direction.
Yeah, that's right. Yeah, and also I recently took my COVID-19 booster because I'm going to Scotland to see a concert at Travis. But my family's cousins take me over there, so I've got to be careful when I'm up there as well. That's why I took the full booster to don't get affected and go to Ireland as well. So
yeah, people. I mean, people with learning disabilities. The vaccination rates are pretty good, and they're pretty good for boosters, third boosters anyway. I think the last I've seen. But it's less among younger people with younger adults with learning disability, and it's less among people from certain minority ethnic groups. So there's still a lot of inequalities in people getting their boosters. And for some people, it's just impossible to get a vaccine. It might be for health reasons or for the whole process of getting a jab. That actually, an injection of a COVID vaccine just isn't possible for some people.
Yeah.
Mm-hmm.
So, no, thanks, sir.
Mm-hmm. Keith's got his hand up.
Good morning to you. It's difficult for being in lockdown for me because I had no. I was nervous. I was very depressed with this COVID virus last year. We were in lockdown for 2 years. I couldn't go back to work for about 2 years. About 2 years now. I work for My Life My Choice in Oxfordshire, and I'm on the Champions Group, and we are campaigning about being on top of the waiting list for learning disability people, and we need to be on the top of the waiting list for the hospitals and the that's what we're campaigning about. Is we doing the can't wait on the waiting list so we can get on top of the waiting list for the doctors and nurses and hospitals.
Yeah, I mean, I think you're certainly not alone in feeling sort of isolated and down in COVID, particularly in lockdown. So I think that's happened to a lot of people. A lot of people with learning disabilities. My Life, My Choice were brilliant part of campaigning for being top priority for the vaccine. And I think the campaign you're running now, My Life, My Choice, about getting kind of top of the priority list for seeing, all sorts of health professionals. So as you say, it's doctors, it's hospitals, but it might be physiotherapy, occupational therapy, speech and language therapy, mental health support. All those things are really important because people have not got what they've needed. And that has had a really bad impact on a lot of people's health. So I think it's a really, really important campaign.
Yeah, yes. We had to do our meetings on Zoom a lot when we are on lockdown from the office on my iPad, and because of the lockdown, it was difficult to go to work to the office in my choice office. It's difficult to work because we had to do it online all the time.
Yeah, I think a lot of people have found that. And it's one of the things that I think some self-advocacy groups have said has been one of the not many positive things about the pandemic is that because loads more people are online now, loads more people are connecting up with each other. So kind of within groups, but across different groups across the country to kind of share what people are doing and campaign together.
Yeah, yes, that's fine.
Thanks, Keith. And Keith, just to let you know, I know that some areas in Yorkshire are prioritising people with learning disabilities as part of health services and the recovery. So if My Life, My Choice wanted to be connected to anybody, then we could, it is possible, is what I mean. Your campaign, some areas have done it. Bradford and Calderdale, I think, but I'll check that, but definitely part of West Yorkshire. So that some people agree with you, some NHS services agree with you.
Yeah, we should ask James if we can do that.
Yeah, yeah.
Right, champions group.
Yeah, Keith, I'll tell James. I know James. I'll drop James a line about it if you want, because I can do that. Yeah, cool. Will do.
Thank you.
And just I said that so you all know it is possible. It's been done by some health trusts. So.
Yeah, that's what happened with the vaccines as well, isn't it? Some local areas just started doing it. And if you can find a few places that are doing it, that's really powerful. Say, well, if they're doing it, why can't you do it?
Yeah. And I guess that's part of why we wanted to hold this session with you today was like Jenny, Chris and I talked about it. We were saying, we want you all to know this stuff so you can take it to your local place and say, what are we doing about this? Or some other people are doing this, why can't we? You know, things like that. It's information is power.
Yep.
Isn't it?
Information is knowledge, knowledge is power.
There you go. Jenny's better at quotes than me. Jenny, is it time for us to hear from Christian and Vicky? Is that right?
Yeah, I think so. Unless anybody else has got any other questions.
Okay. No, great. I'm going to show you one of the short films. So Chris mentioned that some people made some films about their experiences, and hopefully one of us can put the link to them in the chat, but you can use them or anybody can watch them. And I'm going to just share with you the one from Christian and Vicky. There you go. It's great when it actually works, isn't it? So let me press play.
Hello, welcome to Cambridge, to our sofa. My name is Vicky Raphael. This is Christian, my son. And this is the sofa where I think we've spent most of the pandemic and most of the lockdown. So, yeah, so welcome. This week we've had the great pleasure of reading some policy briefings. Coronavirus and people with learning disabilities in England, January 2022. So we feel this is a great opportunity really for us to sit and reflect on what's happened to us and to hear other people's experiences. So very often when there's a very big event that happens in the world, people with learning disabilities don't always get their experiences reflected in them. So it's great to have an opportunity where something which has affected people right across the globe, it's actually also focused on the experiences of people who probably were affected very, very significantly during the lockdowns. So we very much welcome this piece of work. Specifically, we were happy to see that an easy read version and the actual policy briefing were published at the same time, because very often that doesn't happen. And people in Christian's positions wait to get the news kind of secondhand. So thank you for that. So we in the pre-pandemic world, I think, Christian, you very, very much aimed, didn't you, at living an inclusive lifestyle, and being seen was being heard. And I'm not sure how many people realise what the impact of lockdown has had on inclusion and on your physical and emotional well-being. So it's been very interesting to see those personal experiences reflected in this piece of research. I think your experiences very, very much echo other people's, don't they, Christian? We particularly were interested in seeing and hearing about people's experiences of accessing healthcare, because I think that in the pre-pandemic world, Christian, you spent a lot of time working to bridge and lessen the inequalities in healthcare. And it's been really sad to see perhaps how fragile that progress had been and how we now are facing some of the same issues. So, we're finding, aren't we, Christian, that talking to our GP, talking to your GP, and accessing dental health care are both really difficult now, and there are many barriers. There are many more hoops to go through, so phone calls, emails, in order just to get on a list to talk to someone. So we're worried about going forward. So thank you for the recommendations in this report. We think that this report is another opportunity to begin tackling inequality that people with learning disabilities face. And I can't say we're pleased, but we are interested to see that our feelings of isolation have been highlighted in this piece of research. So thank you.
Thank you all very much. I had too many buttons to press there. Too many buttons. Too many buttons. Too many buttons. I hope it was helpful to see Christian and Vicky's reflections, because we just want us to help us all think about how we use what we're learning. And I think Henry next has just a couple of things to share with you that we've been hearing from Learning Disability England members. Is that right?
Yes, that's right, Sam. Yeah. Hi everyone. I'm Henry Wright, the Policy Officer for Learning Disability England. I've just got a very brief presentation to share with you. If I can just locate the thing I want to share.
Do you want me to do it?
I think I've got it. I think I've got it, Sam. The correct thing. Yeah, if you could do it, Sam, that would be great. Sorry. I'm having issues with it. I've been having issues with this all week with sharing screens. If you could share them, Sam, that would be great. Brilliant. Thank you very much. Yeah, so I just want to give you a quick summary of what the COVID rules are now. Give you some information on where you can find the detailed full guidance, and as Sam said, share with you some of the things that we've been hearing from members, some concerns that we've been hearing. So on the 1st of April 2022, the government lifted the last of the COVID restrictions. There's a link here to the Living with COVID plan, where you can see the full document. The current guidance for adults with COVID symptoms is that you should try to stay at home and avoid contact with other people until you feel better. If we could move on to the next slide. So some of the things that Learning Disability England have been hearing from members are that we're hearing a lot of feelings of anxiety from members about the ending of all of the COVID-19 restrictions. As Chris talked about, many people are still shielding or effectively shielding from COVID, and there's a feeling that that they have been forgotten about in the lifting of the restrictions, and that there isn't the support there for them in terms of what do we do now to keep ourselves safe. We've also been hearing concerns that people with learning disabilities are being othered, and that living with COVID or getting back to normal is going to be very challenging for a lot of people with learning disabilities. So as we heard earlier, it's sort of a sense that many of the people who suffered most during the pandemic are still suffering now, even though there's meant to be an idea that we are all getting back to normal and getting back to life as it used to be. And as we saw in the video with Christian and Vicky, we've heard concerns that that there's too much focus on just on keeping people safe at the expense of people being able to live good and fulfilling lives, and that, you know, it's not enough just to keep people safe from COVID. That as Vicky said, it's about being seen, being heard, and being included as well. And then if we can just move on to yeah, thanks Sam. We've just, at the end of these slides, we'll share these with everyone. We've just included a summary of there's a list of complete current COVID-19 guidance for individuals and for different settings, different care settings. So you can see a list of those by clicking on that link. In terms of testing, we've just included a piece of information that free lateral flow tests are no longer generally available to people. Most people with symptoms can no longer get free PCR tests either. You can order a free pack of 7 lateral flow tests every 3 days if you're eligible, and they will be sent to your home. And we've provided the link of where you can check if you're eligible for these free tests, and then where you can order them as well. You can also buy lateral flow tests at high street pharmacies. And we've included a link of all of the information on who can still get free tests. There's a list of people who qualify for free tests, and this includes care home staff and NHS staff who are caring for patients. So you can see that by clicking that link. And also, we've done the same for treatments as well. So some people are able to get antiviral treatments for COVID when they get COVID. And we've provided a link to where you can find out who can get these treatments, and then how to get them, what the process is to get them if you're eligible. We've also provided a couple of easy read links or a link to a couple of easy read letters from the NHS about COVID treatments as well. And then finally on vaccinations, we've provided a link to all the latest vaccination information from the NHS, and 2 easy read links for resources and leaflets about the vaccine and the booster, just at the end there. So hopefully we'll share this, as I said, and hopefully you'll find that useful, just to get the full, you know, to look at anything where you want to see the full guidance or see the guidance in easy read. Thank you.
Has anyone got any questions? Go on, Kevin.
Yeah, I totally agree that they should have kept the free tests, because now people pay for it. It's affecting some people low incomes, and also the cost of living crisis is affecting a lot of people. Energy, high energy bills, petrol getting to work, it's affecting a lot of people, and also people low incomes are struggling. It's the worst, I think, tax rises since 70 years or so. And that also, I think it's cost for 7 packs. Is it £10? Is it, or £8? If the actual throw test, and also they should have kept the isolation thing at work, because now they don't keep it. Now it's why it's spreading at work, because people that don't, I just think, I'll get a virus and give it to people at work, and that's what they're thinking, and they can't take time on sick at work because they could lose a job over COVID sickness as well. That's the worry as well. That's what they got to worry about. Yeah, these are things that's why I do 0 hours contract, Raw Mail, because I work at nights because I can't live and also people on universal credit. If they don't look for work, they could lose their universal credit, and also if they on 0 hours contract they get universal credit, but it's not like the old worker tax credit. When in 2024 everyone's disability benefits going to be in universal credit, and it's going to affect. It's not like the worker tax credit. It's going to affect a lot of families, and also now the sickness that happen. They're not guaranteed sickness on 0 hours contracts as well, and the COVID. That's why people getting the COVID getting the virus and spreading it at work, and some of you don't care. So especially in warehouse environments, definitely. That's what happens. And retail's happening a lot of COVID, getting a lot of COVID, but I think they should have closed the borders a bit. But and also the isolation period should be 5 years. But now that he doesn't want to, he did it because he didn't want to upset his backbenchers. That's why he did it for us. Yeah. And the face mask should have kept face masks in place as well. Yeah. Is that right?
Thanks, Karen. Thank you. No,
Okay,
Jenny,
Samia.
thank you. Jenny, you wanted, because we were just going to ask people to have a bit of a chat with each other about how they could use this research, aren't we? But you wanted to kick that off by talking about what you're trying to do with it locally.
One of the things that I've known locally is some of the public health people don't know about this research, or don't know about it, and also some of the information that they only found out about it on the TV, rather than actually the government actually telling them. And also lots of things came out late, like stuff for people with autism, that they could go out more than once a day. And during the first lockdown, there was a myth going around that you could only go out for an hour for exercise, which was wrong, which was untrue.
Right. So you're saying to us all, do we know if our local public health team know about this research and the recommendations and what they could do? Is that part of what you're suggesting we think about? Yeah.
We share it with our local public health teams.
Yeah, great. Okay. So we're going to put you all in just a little group of 3 or 4 for somewhere between 6.5 and 7 minutes, something like that. But we're just going to give you the chance to talk to each other about, what are you going to do? What could you do with this? How can we, as Vicky and Christian said, it's really good that there was research about people's experiences. They were rubbish and lots of people felt forgotten through the pandemic, but we have some evidence. What can we do with this now to make it better? To try and make what happens next the most useful it can be. So I'm going to just do that thing where I try and work out how to do too many buttons again.
Good luck.
Yeah. Welcome back, everybody. Or at least those of you who've come back. Maybe the rest won't.
Hello, Sam.
Hi, Kev. It's Good to see you.
All right. I got out of the cafe because it was noisy. I was a lecturer at Garden City. I was there. Dave's bookshop. There's a good cafe, it's an independent cafe that sells second-hand books and DVDs, and CDs, and there's a cafe there as well.
Good.
Independent cafe. It's an independent shop anyway. It's quite. Don't mean you get independent bookshops anymore, do you?
No, not very much.
Chris was in the middle of saying something, and then we all got kicked out the breakout room.
In online, as in real life, I start talking and people feel the need to leave the room. I can get it. I get
we
it.
all left that room, not just you, Chris.
I'm so sorry. This is Zoom is brutal, isn't it? It gives you no choice, you know.
40 minutes does sometimes, isn't it?
Yeah. So
Yeah.
I'm sorry. So we've just got a couple of minutes. Is there any kind of points people wanted to share with each other about how, you know, what we might do with this, what you might do with it? Like Jenny says, to public health now. What did you kind of have a conversation about in your group? Anybody want to go? Donna.
I'm just really sorry because Laura got cut off and she was about to say what she did. We were just doing introductions really in our group. But I just want to take the opportunity. I do think that nationally, NHS, and you know this, Sam, anyhow, and Henry, but I think that NHS England nationally should be doing a lot more about post-COVID health inequalities for people with learning disabilities. They just keep saying we've got to deliver these things in the long-term plan, which was pre-COVID. And there's so many big other programs that NHS, and there's the public health people as well, the new people, the new bodies, that are sort of focused on other groups, other populations, and not really talking about people with learning disabilities. And it really worries me how people are going to fall between the cracks. And particularly when Keith was talking about waiting lists, people aren't going to be flagged in hospitals, in eye clinics. I know that. We're going to try and make sure they are, but it needs more direction from NHS England nationally and the new national director. And so anything that we can do all together to sort of say to them, well, you're going to refresh your long-term plan and you need to put in priority for people learning disabilities, and also collect better data. And I really do miss the Learning Disability Observatory. And I think there's an opportunity to call for that again.
Great. Thank you, Donna. Thanks. Laura.
Yeah, I didn't get a chance to speak. That's very unusual, as those of you that know me. But I've got multiple things going on in my head because I think there's so much that's come out of the research, which I think is brilliant, and the recommendations. And then I think it builds on other conversations that we've had sort of with other self-advocacy organisations that I know, you know, Sam has brilliantly instigated on many of it. But that sort of sharing of resources, you know, in our group, we talked a lot about NHS, about the, you know, getting a GP appointment. That, you know, I think somebody had created a easy read document for people with learning disabilities, but also something for the GPs about getting that document. We've worked with Ace Anglia, you know, they've done these brilliant packs for GP surgeries to help GPs understand what's involved. And, you know, we were fortunate to borrow that, and our CCG commissioned us to send those across to all the GP surgeries in Dorset. And it's like, you know, it just feels very sporadic still that, you know, we've got a really good thing going on in Suffolk and Dorset, some brilliant things in Yorkshire, some other bits and pieces. And how I know we've started conversations on the Good Lives work, but it's about how we're bringing that together and how we're getting collectively, and I know that the work that, you know, the meeting we had a couple of days ago is how we're collectively getting messages across to government, to policymakers, to local authorities, you know, who's holding the purse strings, you know, whether it's the NHS, and how we're changing systems, because we, you know, we're all doing little bits. And I know these are brilliant conversations, bringing people together. We've got research, you know, I can use that in funding bids, Chris, you know, it's great, it's really helpful, and that helps us. But I think, you know, to me, there's also this much bigger, longer term plan you know, we can do stuff in Dorset which will support our beneficiaries over the next 3 to 5 years. But actually, we've got to be thinking collectively. You know, how are we sustaining that, and not just in Dorset, nationally. So I hope I've been able to be fairly succinct. There were so many thoughts going on. I hope it's just trying to bring it all together.
Thank you, Laura. No, but that call to action of what can we all come together on? And like Donna says, you know, there might be some things about the long-term plan and the NHS targets, and what else, like you say, Laura, that, you know, we could be bigger. Anybody else? Anything?
Chris has got his hand up.
Just to say that we're up for supporting anything that people are going to be doing with kind of the research evidence we've got and other stuff. We're hopeful that we'll be going back to people sort of autumn this year. So that means we can change some of the questions that we're asking for things that really matter now, that will really help in sort of, I guess, making those sort of campaigning moves and getting the information together later on. So we're absolutely up for supporting whatever people want to do.
Brilliant. Thank you. Thanks, Chris. Well, it's 11 o'clock and we said we'd finish at 11 o'clock, didn't we? Is there anything else, Jenny, that you think we've missed?
Has anybody else got any comments or questions or points? Or I know there's a few people that haven't said anything.
No, you're allowed to come and listen. You don't have to be as chatty as some of us. Chatty is my polite word. So I never shut up if you don't let me. If you don't shut me, keep me quiet. No? Okay. Thank you so much, Chris, for coming and sharing that with us today. And Sue, who's part of the research team with you, has put all the links in the chat. We will send you all out the presentation, the recording, different things after today. But hopefully you've got the links as well. And I guess we'll think about what we can do to help link us all up, to get your offers, to get Chris's offers. If you've got something you think Learn Disability England should do, you know, ask us, tell us. We might not be able to, but we will try, because we think it's really important that we use this the best we can. It's been an opportunity out of, you know, a really tough couple of years for everybody, hasn't it? And as Kev has said to us in the chat, and, you know, in his contribution, it's not over. So we need to keep working out how we make the best of, you know, people learn from what we've gone through for the last 2 years. And thank you, Jenny, today as well.
Welcome.
Okay. Thank you all very much. Take care of yourselves. Thank you.
Thanks, everyone.
Bye,
Thanks,
everyone.
Sam.